Hello, my name is Heung-Yan Wong and I am presenting a video abstract titled Preoperative Tips for Cirrhotic Patients Having Major Abdominal Surgery. Patients with liver cirrhosis and portal hypertension are at particularly high risk of complications following abdominal surgery. One possible intervention to reduce portal hypertensive complications is by placement of a transjugular intrahepatic portal systemic shunt, or TIPS, before surgery. A TIPS decompresses the portal venous system and may reduce perioperative complications. Data is limited to retrospective studies where TIPS was performed for traditional hepatological indications. Here, we present the experience of a tertiary liver unit supporting the management of patients with advanced chronic liver disease having colorectal cancer surgery. Between 2023 and 2025, we identified 8 patients who had a TIPS and proceeded to colorectal surgery. They had an average age of 57 and a Child-Pugh score of A or B. The median time from liver MDT referral to surgery was 155 days. Significant complications post-TIPS occurred in 3 patients, including hepatic encephalopathy, cerebral stroke, and TIPS thrombosis. Intraoperative data showed that 6 out of 8 patients required a blood transfusion within 24 hours of surgery, and 2 patients required 6 or more units of blood products. 2 patients returned to theatre within 1 week because of postoperative bleeding. There was 1 inpatient death due to multi-organ failure, which occurred 3 months after surgery. At longer-term follow-up, 2 patients died approximately 2 years later due to the progression of cancer. Of the remaining patients with 1-year follow-up data, 5 are doing well with ongoing cancer surveillance. Our data also identified a further 2 patients who never proceeded to surgery after a TIPS. This was due to liver decompensation and hepatic encephalopathy. In summary, preoperative TIPS may help facilitate colorectal surgery in selected patients with significant portal hypertension. However, workup for TIPS and portal pressure studies adds a significant delay to surgical intervention. In addition, the TIPS procedure itself is not risk-free. MDT involvement with hepatology, liver and colorectal surgeons, radiology and anesthesia is required to ensure the benefits outweigh the risks. The patient must also be included in this discussion. In conclusion, the efficacy of perioperative TIPS requires further evaluation through a large-scale, multi-center trial reviewing outcomes such as bleeding, mortality, and morbidity. Thank you.